One.
Hi there, Larry. My name is Marisol, and I'm your nurse for today. And we're just gonna go ahead and place an NG tube on you, okay? So I just have all my supplies, and then I'll go ahead and explain the procedure a little later. But first, we're gonna go ahead and get hand sanitizer and put some gloves on. Okay. I'm gonna raise the bed, okay? Okay, can you go ahead and tell me your first and last name, please? Okay, and Mr. Larry, do you know where you are? Okay, and do you know which month it is? All right, great. So I'm just gonna go ahead and take your vital signs, a blood pressure cuff, your temperature, your respiratory rate, and I'm just gonna go ahead and leave this O2 saturation monitor on you, the oximeter, so we can monitor your O2 stats. Mr. Larry, do you have any allergies that I should be aware of? No? Okay, great. So I'm gonna go ahead and come on this side. And I'm gonna start preparing my things, okay? Okay, Mr. Larry, so I have all of your supplies here. So basically what we're gonna be doing is putting a nasal gastric tube in you. And it's basically just a tube that's gonna go all the way from your nose and to your stomach. I know it sounds scary, but this is gonna help us just put medication through there and also, do tube feeding, okay? So I'm gonna go ahead and leave your oximeter on just so that we can monitor your O2 saturations and we make sure that it's not going into your lungs. And I'm also gonna go ahead and put you in a high bowel position, okay? And if you have any questions, please, feel free to let me know, okay? And then with my pen light, I'm just gonna go ahead and look in your nostrils, okay? Yeah. I don't see any obstructions. So I'm gonna go ahead and start measuring the nasogastric tube to see how far we should put it in, okay? I'm just gonna put these on you just in case, there's any secretions. There shouldn't be. Okay, and I'm gonna go ahead and take my nasogastric tube set. Before I do that, I'm just gonna go ahead and go ahead and take this out, make sure to save it. Okay. So I'm gonna measure the nasogastric tube from the tip of your nose to your ear. Sorry, I'm gonna bring this down a little bit, okay? To your ear, and then from there. We're gonna go to the xiphoid process, and then from that, I'm gonna add 15.2 centimeters. Okay, so it's around there. I'm just gonna go ahead and place this tape around this so I know where my marker is. Okay, so measured.
One.
Okay, Larry, so now that we have it all measured up, I am ready to go ahead and start inserting it in your nose, and then it's going to pass through your throat, so that may feel a little bit uncomfortable. I do have some water with the straw here, so that I can ask you to take some sips of water and swallow as we're doing this, and then yeah, so it might be a little bit uncomfortable. Please, try to tell me if it hurts or something, because I don't want to hurt you. but I'm gonna go ahead and apply some lube on the tip of this, okay? Just so that things get through a little better. Okay, now it's all lubed up. I'm ready to start, okay? Are you ready? All right, so I'm gonna go ahead and go through your nostril. Okay, and now I'm gonna go ahead and take my pen light and look. And it's in your pharynx area. So I'm gonna ask you to go ahead and just put your head down, okay? Okay, and then I'm gonna keep going. I'm gonna ask you to take a sip of water. Okay, go ahead and swallow. You're doing great, Mr. Larry. You're so brave. Okay, I'm just gonna grab some tape so that we're ready to tape it onto your face. Okay, so I'm gonna start with this piece.
Okay, so I'm now going to be making sure that the patient's pulse oxygenation is on, that their vital signs have been taken, and I'm just going to assess their gastric medication too. Okay, perfect. Okay, then I'm now starting the procedure. So I'm first going to get the and I'm going to lubricate in.
Okay, and then we're gonna add another piece.
I'm going to inform the patient that they might feel some discomfort, but that I'm going to ease them through this process. So then I'm going to take the tubing and administer it into the right nostril, which I assessed was the best for him during my initial assessment. I'm going to
Now we're just gonna go ahead and place it over here as well.
thank you. Okay, we're doing that. Okay. Thank you.
Let's take this off real quick and then do it, okay? Does everything feel fine?
Okay, so I'm going to be making sure that full off.
And then I'm just gonna go ahead
Okay,
and put this little
that
piece
vital
back.
signs have been measured, and
Just 'cause
I
we don't
am
need
going
it
to be
for
assessing
now.
their gag reflex, making sure that is good, and it is.
Okay,
Okay, so
just
then
gonna
I'm
add
going to be
another piece right there.
measuring the beginning. So I got the tubing, I'm going to be measuring from the patient's nose to the ear.
Okay, so I'm just gonna tape this down here, and then I'm gonna go ahead and grab this clamp, and I'm gonna attach it here, okay? Okay, and then I'm just gonna go ahead and make sure to clamp it, okay? Okay, and it's all clamped. So I'm gonna go ahead and wrap this up. And I just advise you, please don't move it, please don't tug at it, because then it is gonna come off, okay? We are gonna send you to get some x-rays done just to see that it's in the correct placement. And if I have to, I can also aspirate from this, you know, just to see what comes out and the color of it. But besides that, we're all done. I'm gonna go ahead and put the bed down. And then, are you comfortable in this position? Yeah, okay. Okay, the bed is all the way down. I'm just gonna gather my supplies and go dispose of them, okay? I hope you have a great day, Mr. Larry, and I'll come back later. So I'm just gonna go ahead and go to the nursing station, and I'm gonna go ahead and document. So on my computer, I'm gonna document the day the NG tube was placed, as well as the size of the NG tube, also which nair the NG tube was placed in. I'm also gonna go ahead and document if there was any aspiration, and then as well as how we confirmed if the NG tube was in the right place. I'm also gonna go ahead and document if the patient was able to tolerate the procedure,